Urgent signs. These include some respiratory distress, some dehydration,
unable to drink, feed, or vomits everything,
malnutrition, visible severe wasting, malnutrition edema, pitting edema of both feet, unwell child with known diabetes, any other burn less than 10%, closed fracture, and dislocation of finger or toe. Once an urgent sign has been identified, the TEWS needs to be calculated and we need to check for additional investigations before a priority level is assigned to the patient. Some respiratory distress. When you assess the airway and breathing, there may have been signs present that you do not think were severe. For example, lower chest wall indrawing, not severe, or difficulty in breathing, not severe. In this case, the child does not require emergency treatment but will need urgent assessment. Decisions on the severity of respiratory distress come with practice. If you have any doubts, consult the senior healthcare professional immediately. An important additional investigation would be indicated if the respiratory rate scores 1 point or more on the TEWS. In this case, we would measure oxygen saturations, and if they are found to be below 92%, give oxygen and move to the resuscitation area. Some dehydration. Diarrhea or diarrhea and vomiting, plus one or more signs of dehydration. Infants and children with diarrhea or vomiting may have lost enough fluid to show one or more of the following signs of dehydration. Sunken eyes, ask the mother. Restless, irritable. Thirsty, decreased urine output. Dry mouth, crying without tears. Skin pinch slow, less than 2 seconds. If the child is found to have diarrhea or diarrhea and vomiting plus one or more of these signs of dehydration, they would be considered to have an urgent clinical sign. Because these children have losses that are ongoing and difficult to quantify, they need to commence oral rehydration therapy as soon as possible to avoid becoming severely dehydrated or shocked. Most of them are thirsty and their mothers need to offer them extra fluids according to the oral rehydration corner guidelines. Infants and young children that are breastfed should be encouraged to continue to do so whilst awaiting further urgent assessment. Unable to drink, feed, or vomits everything. Infants and children that are not well enough to feed or are vomiting everything may have serious medical conditions affecting any of the body systems. Examples include septicemia, meningitis, heart conditions, acute surgical abdomen, pneumonia. Vomiting only and dehydration is a concern. Beware, the child may have an acute surgical bowel problem. Oral fluids may be contraindicated. Seek advice from a senior healthcare professional. Malnutrition with visible severe wasting. This is a form of severe malnutrition. These children are easy to pick up because their muscles are very wasted and they have loose skin folds particularly noticeable around their upper thighs, buttocks and upper arms. If you are concerned that a child might be malnourished, look rapidly at arms and legs. They are prone to hypothermia, hypoglycemia and infections and need to be managed urgently according to the WHO severe malnutrition guidelines to prevent complications. Do a finger prick glucose test and check with a senior healthcare professional. If the glucose is below 3 millimole per liter, move to the resuscitation area. Malnutrition with pitting edema of both feet. This is another form of severe malnutrition. It is as dangerous as the one described above and is recognized by the pitting edema of both feet. They may also present with general body swelling. If you are concerned that a child might be malnourished, Look rapidly at the child's feet and check for edema of both feet. These children often appear listless and apathetic and have skin and hair changes. They are also prone to hypothermia, hypoglycemia, and infections, and need to be managed urgently according to the WHO severe malnutrition guidelines to prevent complications. Do a finger prick glucose test and check with a senior healthcare professional. If the glucose is below 3 millimole per liter, move to the resuscitation area. An unwell child with known diabetes. Children with diabetes often lose control of their sugar levels when they are unwell from acute illness and infections, for example, acute respiratory infections, upper or lower, urinary tract infections, or diarrhea. They often develop high or low blood glucose levels because their insulin needs may increase or decrease whilst they are unwell, and they are not eating as usual because of loss of appetite, nausea, or vomiting. Do a finger prick glucose test. If the glucose is below 3 millimole per liter, move to the resuscitation area. If the glucose result is high, check with a senior healthcare professional. Burn less than 10% of body surface area. The size of the burn needs to be determined using the Palmer method, which is the patient's outstretched open palm, including the fingers, which indicates 1% of the body surface area. Check with the senior healthcare professional for analgesia initiation as an additional task. If the burn occurred recently, within the last 3 hours, it is still worthwhile to cool the burnt area with water, for example with cold tap water for at least 30 minutes. The burn should then be dried and covered with cling wrap or a clean dry sheet. The child should also be wrapped in a blanket and kept warm. Closed fracture. These children often present with pain on moving or refusal to move the affected limb. There may be deformity of the limb evident. Check with a senior healthcare professional for analgesia initiation. Dislocation of finger or toe. This often causes an obvious deformity. The dislocated digit will need to be reduced under some form of anesthesia. Check with the senior healthcare professional for analgesia initiation. In summary, once an urgent clinical sign has been identified, continue with the TEWS calculation, check for additional investigations before assigning the final triage priority level. Then continue with additional tasks and hand over to the senior healthcare professional.